Assalamu alaikum. In this day we are going to talk about physical hazards. In this lecture we go to identify the heat effect as physical hazard, clarify the decompression sickness, clarify the vibration effect on the workers, and identify the noise and its hazards. First we will talk about heat. As we know, heat in the occupational environment is a common hazard, and with increased industrialization, deeper mines, and imminent climate change due to global warming is sure to become a larger occupational health and safety risk in the future. Heat illness. The incidence of the disease. Heat illness. The incidence of the disease shows seasonal variation. The incidence of the disease shows seasonal variation. 3/4 of the cases occurring during summer month. This is due to the high temperature during that season. Heat illness risk factors. There are many factors that affect the heat illness. These include personal risk factors like age, people over 65 years old, overweight, ill, or taking certain medication are affected more than others. General health, fever, dehydration, heart disease, mental illness, poor circulation, all of these increase the incidence of heat illness. Acclimatization. The body needs time to adapt working in hot places. First time that one if the person work for first time in a hot place. If a person work for first time in a hot place, he has a great incidence to get heat illness. To get heat illness. To got heat illness. Alcohol and caffeine. Alcoholic beverage, coffee, tea, or other drinks containing caffeine will dehydrate the body and increase the incidence of heat illness. Other factors include environmental risk factors, working conditions that create the possibility that heat illness could occur, like air temperature, relative humidity, radiant heat from the sun, workload severity and duration. The harder the work and the longest duration, it will increase the incidence of heat illness. Protective clothing and personal protective equipment worn by employee. Heat illness include three types. Heat illness include the following. Heat cramps. This means painful muscle spasm that occur due to dehydration and loss of nutrition from excessive sweating, usually associated with the heavy perspiration. Heat cramps are most common in the leg, arms, abdomen, and back. How do heat cramps develop? When work in a hot place, there is excessive sweating, and the body loses nutrition when it sweats. If nutrition are lost more quickly than they are replenished, it can lead to cramps. So, cramping is one of the first signs you so cramping is one of the first signs your body can't handle the heat, and we have to take action and prevent the progression of heat illness. How we deal with how we can deal with the heat cramps? As we say, heat cramps is the first stage of heat illness and is the most easy to deal with it. Get out of the heat and cool down. Rest in a well ventilated or air conditioned area. Drink water and an electrolyte beverage. Consume water frequently over the next few hours. Make your own salted drink to replenish lost nutrition. The other stage of heat illness is heat exhaustion. In this condition, the symptom may include heavy sweating and a rapid pulse that result of your body overheating, that result in increase the heat of the body. The causes of heat exhaustion. The causes of heat exhaustion. The causes of heat exhaustion The causes of heat exhaustion include exposure to high temperature, particularly when combined with the high humidity, and strenuous physical activity. Without proper without without proper treatment, heat exhaustion can lead to heat stroke, which is represent life-threatening condition. Fortunately, heat exhaustion is preventable. So the first stage, heat cramps and heat exhaustion, we can deal with it. The sign and symptom of heat exhaustion: moist skin, heavy sweating, faintness, dizziness, fatigue, weak rapid pulse, low blood pressure upon standing, muscle cramps, nausea, and headache. In most cases, we can't treat heat exhaustion by doing the following: rest in a cool place, getting the person into an air-conditioned building. But at the very best, rest in a cool place, getting into an air-conditioned building is the best step. But at the very least, but at the very least, find a shady spot or sit in front of a fan. Rest on your back with your leg elevated higher than your heart level. Try cooling measure. If possible, take a cool shower or put towels soaked in cool water on the skin. Drink fluid. Drink cool fluids. Loosen clothing. Remove any unnecessary clothing and make sure your clothes are lightweight and non-bending. The other stage of heat illness is heat stroke, or sometimes it's called sunstroke. It is a life-threatening condition. If we not deal with the heat cramps or heat exhaustion from the start, it may be passed into heat stroke. The victim temperature control system, which produce sweating to cool the body, stop working. The body temperature can rise so high that brain damage and death may result if the body is not cooled quickly. Therefore, we say it is a life-threatening condition. Therefore, we said it is a life-threatening condition. The signs and symptoms of heat stroke. The following are the heat stroke signs and symptoms. Vomiting, decreased alertness level or complete loss of consciousness. High body temperature, sometimes more than 40 Celsius, sometimes above the 40. The skin may be still moist from sweating, or the person may stop sweating and the skin may be red, hot and dry. Rapid, weak pulse. Rapid, shallow breathing. Treatment of heat stroke. It is an emergency. Treatment of heat stroke. Because of it is a life-threatening condition, it is an emergency. Preparation to transmit the patient to hospital, and during that, move the person to cooler place, quickly cool the body till reach the hospital. A prevention of heat-related illness. Prevention of heat-related illnesses. Wear loose-fitting and high-weight. Wear loose-fitting and lightweight clothing. Wearing excessive clothing or clothing that fit tightly will not allow your body to cool properly. Will not allow your body to cool properly. Protect against sunburn. Sunburn affects your body's ability to cool itself. So protect yourself outdoor with a wide-brimmed hat and sunglasses, and use a broad-spectrum sunscreen. Drink plenty of fluids. Staying hydrating will help your body sweat and maintain a normal body temperature. Use salty snacks such as nuts. Use salty snacks. Take breaks from the heat to cool down and stop sweating. Schedule exercise or physical activities for cooler parts of the day, such as early morning or evening. Get, get acclimated. Get acclimated. Limit time spent working or exercising in heat until you limit time spent working or exercising in heat until you are conditioned to it. Take extra precaution with certain medication. Never leave anyone in parked car. It is not safe to leave person in parked car even if the car is in shade. Refrain from drinking alcohol, caffeine, and surgery. Refrain from drinking alcohol, caffeine, and sugary beverage before, during, and after being in the heat. If you participate in a strenuous sport event or activity in hot weather, make sure there are medical services available in a case of heat emergency. The other example of physical hazard is the pressure. Decompression sickness, also called BANS or Kaysen disease, refer to injuries caused by rapid decrease in the pressure that surround you, or either air or water. It occurs most commonly in scuba or deep sea divers. Also, it also can occur during high altitude or unpressurized air travel. However, decompression sickness is rare in pressurized aircraft, such as those used for commercial flight. The signs and symptoms of decompression sickness include joint pain, dizziness, headache, difficulty thinking clearly, extreme fatigue, tingling or numbness, weakness in arm or legs, skin rash. More serious symptoms are caused by bubbles of nitrogen in the pulmonary vasculature. More serious symptoms are caused by bubbles of nitrogen in the pulmonary vasculature. Most serious symptoms are caused by bubbles of nitrogen in the pulmonary vasculature and are known as the chokes. These symptoms occur later than the BANS, sometimes following several hours of complete well-being after decompression. So sometimes the patient who complain from decompression sickness sometimes become well, but after that the symptoms return and more serious. There is a sensation of burning retrosternal distress, cyanosis, cold and clammy, and the pulse is steady. Emergency treatment for decompression sickness involve maintaining blood pressure and administering high flow oxygen. Fluid also may be given. We have to keep in our mind that the optimal treatment is the use of hyperbaric oxygen chamber, which is a high pressure chamber in which the patient receives 100% oxygen. This treatment reverses the pressure change that allow gas bubble to form in the bloodstream. Now we will talk about vibration as another example of physical hazards. Vibration means weakly movement back and forth, up and down, above a point of equilibrium. Types of vibration. We have two types, either whole body vibration or hand-arm vibration. For whole body vibration, this is caused by poorly designed or poorly maintained vehicle. This vehicle will cause or exacerbate other health effects, such as lower back pain due to damage of vertebrae, cause or exacerbate other health effects such as lower back pain due to damage to vertebrae and disc ligament loosened from shaking, can cause motion sickness or bone damage. Varicose vein, heart condition that results in variation in blood pressure from vibration. The other effect of vibration can cause varicose vein or heart condition like variation in blood pressure. It can affect stomach and digestive conditions. Vibration can cause varicose vein, heart condition, like variation in blood pressure. It can affect stomach and digestive. It can affect stomachs and digestive condition. It can affect stomach and result in digestive condition. The longer a worker is exposed to whole body vibration, the greater the risk of health effects and muscular disorder. The other type of vibration, hand-arm vibration. Long-term exposure from using handheld tools, such as pneumatic tools, concrete breaker, concrete breakers, chainsaw, grinder, and other. This will cause a range of conditions and diseases, including white finger, or sometimes what's called dead finger. It can result damage to tendon, causing whiteness and pain in the fingers. It can cause carpal tunnel syndrome, sensory nerve damage, muscle and joint damage. Workers using pneumatic tool and chainsaw are commonly found to have small cysts, vacuoles, osteoporotic change in the bones of the wrist. On the X-ray examination, These, these are usually symptomless and do not give rise to any complaint. So sometimes we are find such finding. So sometimes we find. So sometimes it is accidental to find these findings without any complaint. Now we'll talk about vibration of. Now we'll talk about the prevention of vibration. Exposure action and exposure limit value are defined for vibration hazards. Obligation on the construction site. The employee is obliged to conduct a risk identification and assessment study at workplace where vibration is a hazard. Exposure action and exposure limit value are defined for vibration hazards. Obligation on the construction site. The employer is obliged to conduct a risk identification and assessment study at workplace where vibration is a hazard. Duration of exposure. The duration of exposure should include only the time during which the employee is in contact with the vibrating surface. Interruption and breaks should not be included in exposure times. Manufacturers are obliged to declare. Manufacturers are obliged to declare whole body vibration value exceeding half millimeter to declare whole body vibration value exceeding half and hand arm vibration value exceeding 2.5 in the user instruction. Suspension seats. The machine should be equipped with the suspension seats. The machine should be equipped with the suspension seats, which must be adjusted to the driver's weight. To reduce vibration to a minimum. Reduction of hand-arm vibration. This can be done if the equipment should be always be suitable for the task concerned, and the duration of exposure for the employee is to be kept as low as possible. Anti-vibration handles. One possibility for reducing hand-arm vibration lies in the use of vibration-reducing padded handles. Anti-vibration gloves can be used. Anti-vibration gloves may be less in high-frequency vibration. Now we'll talk about the noise. There are many occupations in which the daily exposure to noise may impair hearing or reduce efficiency, or both. The maximum sensitivity occurs between 1000 to 4000 cycles per second. The auditory field lies between 20 to 20,000 hertz. As the intensity of sound increases, auditory fatigue becomes more marked and may be associated with the tinnitus. Occupational hearing loss usually has a gradual and often unsuspected onset. The first sign is a slight impairment of hearing. This is detected by audiometry in the 4000 range. The first sign is a slight impairment of hearing, detected by audiometry in the 4000 Hz range, spreading at a later stage to the 3000 to 6000 Hz range. This characteristic pattern allows occupational hearing loss to be differentiated from other forms of deafness. When hearing loss occurs in these frequencies, speech becomes increasingly difficult to understand. The patient suffers from some degree of social handicap. Impulse noise is the most dangerous form, gunfire being notorious for damage. Gunfire can damage the hearing. The intermittent noise of drop fucking is another source which can lead to a rapid deterioration in hearing. The other effect of noise is non-auditory effect of noise. On the other hand, the noise can result in non-auditory effect. This can be seen as increase or decrease in the heart rate depending on the type of noise. Respiratory rate often increase, decrease cardiac output. There is a peripheral vasoconstriction which may cause blanching of the skin. There may be hypertension, nausea, and sometimes vomiting. Noise can affect the performance of psychomotor tasks. Noise can affect the performance of psychomotor tasks, either adversely or beneficially depending upon the either adversely or beneficially depending upon its intensity. Hearing conservation. Reduction of noise at source. Limiting exposure with or without ear protection. Routine monitoring of the workplace of the work population exposed. Prevention. Now we'll talk about the prevention method to deal with the noise. Reduction of noise at source. Limiting exposure with or without ear protection. Routine monitoring of the workplace and of the work population exposed. Reducing noise at source can be achieved by enclosing noisy area with sound insulting partition, silencing exhaust system, enclosing noisy machine, enclosing the operator of noisy machine, We have to keep in our mind exposure to a noise in 8-hour day should not exceed a level of 90 decibel. Routine noise monitoring has been undertaken. Noise areas should be clearly identified with the posters that carry notes to warning of the need to use ear protector. Ear protector are of several forms. The simplest form are earplugs, either reusable rubber or plastic plugs, which come in several sizes. We have not to forget, care must be taken to keep them clean by regular washing, or disposable gloves, or disposable plugs. Cotton wool is an extremely poor protector and should be not used. The most effective form of protection is the ear muff. The degree of protection they offer is tested by audiometry, and their efficiency varies according to the frequency of the sound. But their main disadvantage is that they are uncomfortable because they are sweat traps. So make the workers preferring the less effective earplugs. So make the workers preferring the less effective earplugs. Thanks for listening.